Cardiac electrophysiology is a treatment of heart rhythm disorders specifically. And so we're sort of the electricians of cardiology, and we place pacemakers for slow heart rates and defibrillators for people with weak hearts or high risk of cardiac arrest, and we do ablations for people who have abnormal rhythms.
Sometimes people have plumbing problems, and sometimes people have electrical problems. Sometimes people have both. So we're pretty quick to collaborate with Dr. Talbert, our electrophysiologist, when patients are having arrhythmia or other issues. A lot of times, arrhythmias cannot be terminated by just medications alone, and having ablation can actually restore normal rhythm and can really improve patients' outcomes and quality of life.
It's an outpatient procedure. The procedure itself takes anywhere from 2 to 4 hours, depending on how much arrhythmia is there. You get in there and ablate the area that needs treatment, and then nothing stays in, it comes out, and then you go home the same day.
For atrial fibrillation, which is the most common rhythm in heart disease, the medications have a 38% success rate in controlling that long term. Ablation has an 80% success rate, and if you ignore it and don't do anything about it, the risk of stroke is 5 times higher than the national average for people who are in normal rhythm.
Having cardiac electrophysiology here in Hot Springs has made a big difference in impacting our patients' lives. Now all these procedures can be performed in-house in Hot Springs, which means our patients don't have to go to Little Rock anymore for these procedures.
Timeliness is very important, especially with atrial fibrillation. Heart rhythms are not just a thing that bothers you until you go back to normal and everything's okay. That's not true. The longer you stay out of rhythm, it develops scar tissue in tiny microscopic spots in your heart, and that damages your heart. What you have to recognize is that you're winnowing away precious time, and the longer you've been out of rhythm, the harder it's going to be to fix.
If you're someone considering having an ablation procedure, just go ahead and schedule it, get it done. It will prevent long-term health problems.